Okay, I'm Dr. Muhibullah Wazir, and the topic is the carpal tunnel syndrome. Over here, passing through the carpal tunnel or tendons of the long flexor muscle digitorum superficialis, flexor carpi radialis, and flexor pars longus, and also the median nerve passes deep to the flexor retinaculum. While one branch of the median nerve, it passes superficial to the flexor retinaculum and supplies the skin of the thinner eminence, that is called as palmar cutaneous branch of the median nerve. Otherwise, the median nerve by itself passes deep to the flexor retinaculum, crowded in these tendons, tightly crowded. That's why if there is any inflammation of the joint, or if there is synovitis, or if there is any edema due to any reason, what happens? Because of the small space being lying deep to the flexor retinaculum, the median nerve become compressed. As a result of compression of the median nerve, what happens? The patient will feel some effects. Okay, number one, the median nerve supplies the skin of the three and a half fingers skin of the ventral side, as well as the nail beds on the radial side. So 1, 2, 3 and this half finger skin along with nail beds is being supplied by median nerve. That's why when the median nerve is complex, there will be an impaired sensation over the skin. The patient will say, the doctor, when you touch this finger and we touch this finger, there is a difference. Over here the sensation is less because of compression. Secondly, the median nerve supplies these thinner muscles. So what will happen? That because of compression of the median nerve, these thinner muscles will be paralyzed, and ultimately there will be wasting. And when you compare these two thinner eminence, one of it will be wasting or thin as compared to this one. But the skin over the thinner eminence will not be affected in carpal tunnel, because the palmar cutaneous branch of the median nerve, it passes superficial to the flexor retinaculum, and that branch is not compressed over here. Then lastly, that's why because of these thinner eminence muscles, which are muscles of the thumb, the movement of the thumb will be affected. The movements of the thumb will be affected. That is adductor pollicis brevis and flexor pollicis brevis. And the flexor pollicis longus muscle, which originates from over here, passes deep to the flexor retinaculum and being attached to the distal phalanx and being supplied by the median nerve over here will not be affected, and the other movements of the thumb will be affected, but the distal phalanx of the thumb would be flexed easily because it is being done by flexor pollicis longus, and the flexor pollicis longus is being supplied by median nerve in the proximal part, not distally. But if there is median nerve compression somewhere at a higher point, for example, sometimes it is being compressed over here in ligament of Trutter or any other point, then what will happen? Then these flexor muscles will also be wasted, and the skin over the thinner eminence will also be impaired sensation, and the flexion at the distal phalanx will also be affected. So you would say then you will diagnose that the median nerve is compressed at a higher level. But if there is only impaired sensation in the lateral 3.5 fingers, and the movement of the thumb is being affected, wasting of the thinner eminence, but the distal phalanx flexion is not affected, then the median nerve is being compressed over here in the carpal tunnel, and this is called as carpal tunnel syndrome. This is a common disease. As a doctor, you will come across it, and then what you do, that you give incision and you cut the flexor retinaculum so that to relieve the pressure over the median nerve, or before that you can give the deposteroid injection over here, and with the help of deposteroid injection the edema and swelling is being reduced, and the compression over the median nerve is being reduced, and the carpal tunnel syndrome will be relieved. If not, then you divide and you cut or incise the flexor retinae column, and it will be this surgical procedure that you do at the end. Okay, this is all about the carpal tunnel syndrome. I hope you will get it. Thank you very much.